Now here's someone who has also attended all 3 of our courses, Dr. Christopher Nagy.
Well, I'm Christopher Nagy. I'm an orthopedic surgeon from Salisbury, North Carolina, which is a little off the beaten path as far as age management medicine is concerned. But it's an area that I've been interested for a long period of time, and actually my journey in this path started about a year ago. Attended an age management medicine meeting, and the more I learned about it, the more I found out about it, the more I thought, this is the way we ought to practice medicine. I mean, even though I'm an orthopedist, a lot of the health crises that we're seeing affect me. People with arthritis, overweight, all kinds of medical problems. And so I've sort of pursued this path in learning about the field of age management and wellness medicine as opposed to sickness medicine. And you know, the more I learn, the more I want to learn, because I think it's the way medicine should be practiced, but it's just often just pushed to the side as alternative medicine. So I've actually set up a wellness center, your personal wellness center, that to treat patients who are interested in primarily hormone replacement, but it goes so much more beyond that. Sure. Proper diet, proper nutrition, addressing toxicities and such. And so I've actually set up a wellness practice outside of my orthopedic practice, trying to help people achieve their health goals. There's such a hunger out there in the general population for knowledge that is just not really being addressed. And another problem is there's so much information out there. Most people, lay people specifically, don't know how to separate the wheat from the chaff. What's right, what's wrong, what do I do? And then you develop analysis paralysis and you do nothing and you're right back where you started. So I think, you know, particularly in the field of age management, that addresses a lot of those needs, and there are certain things that you can do that will pay big dividends as far as health and wellness over the long term. I've received more positive feedback, thank you, I appreciate you, in this particular field than I have in all of my years as an orthopedist. Just, you know, if you can help somebody achieve their goal of health and wellness, that means a lot to them. And not specifically just, here's another drug, take this for your symptom. Let's get to the root problem and fix it. So I've had excellent feedback, outstanding. And to me, that's the reward for me. You know, it's not just about running an effective business. It's helping people achieve their goals of health. And that's part of the reason I started to come to these conferences initially, because I knew if I was going to take this alternate path, which may not be accepted by mainstream medicine, I was going to have to be able to back up the things that I was doing. And that's certainly what I appreciate about his courses. Now I have a number of papers I can quote and show to people who doubt what I'm doing is correct. Even seasoned medical doctors that have been but it's one of those situations, if you always do what you've always done, you'll always get what you always got. And there's a whole new world out there that I think needs to be addressed, and I think he does that very well in these conferences. Well, I would encourage anybody who even has a shred of interest to look into and read about the practice of age management. It's easy to push something to the side as not being relevant if you don't understand it or you haven't even taken the time to look into it. It's what, you know, some people may call this alternative medicine. I call it real medicine, because alternative medicine's trying different things and seeing if that works. This is giving the body what it needs to heal itself. So I hope more doctors adopt this type of medicine versus continuing to throw synthetic chemicals at people and hoping for a good result.